Okay, welcome to the second video in our Synapses lesson. We covered some introductory things about synapses in general. In the first video, we covered the neuromuscular junction, which is a nice one to start with, and how that operates. And now we're going to talk about the central nervous system, which is slightly more complicated because it's a more complicated organ. We have two types of synapses, excitatory and inhibitory. I'll start with the excitatory synapses. Unlike skeletal muscle, you usually need a lot of synapses per neuron in order to cause the neuron to hit threshold. And that's because you don't have an end plate potential that gets up way high that is meant to ensure that you hit threshold. Instead, you have a process of summation going on, which I'm going to describe in a moment, so that if you get a bunch of inputs and they excite the membrane enough, then you'll hit threshold and you'll fire an action potential. If there aren't enough inputs, then there'll be subthreshold, okay? And they won't fire an action potential. Again, a typical excitatory postsynaptic potential, EP/SP, 1 to 2 millivolts. And these have to add up via a process that we call summation. So 1 to 2 millivolts, an increase of that from rest isn't going to hit threshold. You have to have a bunch of these EP/SPs kind of summate and bring the voltage up higher and higher until you finally hit threshold in order to finally throw an action potential. So excitatory synapses, generally speaking, the ones that we talk about, certainly the ones we're going to talk about today, use glutamate as the neurotransmitter, they, naturally enough, the ones we're going to talk about today, bind glutamate receptors, which are also channels, so these are directly coupled, at least the ones we're going to concentrate on, okay? They are cation channels. They actually do allow both sodium and potassium to come in through the channel, and the ACH, the nicotinic receptors that we talked about in neuromuscular junctions, also do this. Note that when this happens, the net effect is to depolarize the membrane. So if you're at rest and you allow some sodium to come in and some potassium to go out, the tendency is to migrate up toward like about 0 millivolts, which means the tendency is to increase the voltage or make it less negative from rest. So these cause depolarization. Don't be fooled by the fact that some potassium is coming in at the same time the sodium is going out. The net effect is to bring the voltage up, okay? We have two types. We have NMDA receptors, that is receptors that bind N-methyl D-aspartate. This is not physiological ligand, but it does differentiate between the two different receptor types. We have non-NMDA that don't bind this. We have NMDA that do. This is strictly a ligand-gated receptor, and the NMDA, so this one binds the ligand and opens. Simple as that. It binds glutamate. This one binds glutamate, and it needs to do that, but it also needs some depolarization to the membrane to open. Just binding glutamate isn't enough. You need some change in voltage. But this one is special because in addition to sodium and potassium flowing, it allows calcium to flow into the cell. And as you know, calcium is a really important signaling molecule. When it goes up, it causes changes in the cell. And so this can result in changes in the cell, and these receptors tend to be associated with things like memory, or they can, if they're going wrong, they can be associated with epilepsy. That's why we're teaching them. I'm just introducing them here. Dr. Hepner and his cohorts in the brain behavior and cognition block will talk more about this, I'm sure. I just want to introduce it along with the synapses here. That's our excitatory synapses. We also have inhibitory synapses in the CNS. These are mostly directly coupled. Most directly coupled inhibitory synapses use glycine or GABA, which is GABA-aminobutyric acid, as the neurotransmitter, okay? Receptor/channel for these neurotransmitters is the chloride channel, okay? So the reason why this works, as you guys know now, chloride isn't actively transported. So it kind of flows with the membrane voltage. If the membrane voltage is more positive, chloride will accumulate in the cell because it's attracted to the positive charge. If it's more negative, let's say at rest, then there'll be less chloride because the negative charge is pushing the chloride away and keeping it out. Okay? Basically, chloride flows across the membrane until it stops flowing. And when it stops flowing, by definition, that is when the membrane voltage is equal to the equilibrium potential. So the chloride concentrations change until the equilibrium potential is equal to the membrane voltage. If you're talking about a cell that spends 90% of its time at rest, that means the equilibrium potential will be the resting potential. Now you'll remember in cardiac muscle this wasn't true. It spent about a third of its time depolarized, so the equilibrium potential was higher than rest. But in neurons and skeletal muscle, it's a lot easier. The equilibrium potential is equal to the resting potential. Well, if I open a bunch of chloride channels, that means that chloride is going to always tend to pull me toward the resting potential. And the more open chloride channels I have, the more it's going to pull me. So while your excitatory synapses are trying to pull your voltage up, the minute voltage moves off of the resting potential, chloride channels are going to try to pull it back down toward the resting potential. So they're always going to be fighting your excitatory synapses because they're always going to be trying to keep the membrane potential at rest. So the more open chloride channels I have, the more resistance to increases in voltage I have. That is why inhibitory synapses often have chloride channels. Some of them have potassium channels as well. As you know, potassium channels will pull you down toward the equilibrium potential for potassium and will fight the excitatory synapses even harder. The ones we're talking about today are chloride. They're going to pull you toward rest, okay? Sometimes, not always, when you have an inhibitory synapse that is activated, you will see what's called an inhibitory postsynaptic potential. So the excitatory postsynaptic potential is when the voltage goes up. Inhibitory means the voltage will go down. Now, you don't always see this. If your membrane is sitting at rest and you open a bunch of chloride channels and that's all you do, you're not going to change the membrane voltage because the equilibrium potential for chloride is the resting potential. So yeah, the chloride channels are going to pull you harder toward rest, but you're already at rest. So the voltage won't change. But if the membrane is slightly depolarized, let's say because we've had some EPSPs that are fired, and it's slightly above rest, then opening a bunch of chloride channels at the same time will actually cause a drop in the voltage toward rest. And every once in a while you'll see that they're called IPSPs, okay? Occasionally, you know, you should be aware of what those are. You don't always see them, however. How do these synapses work? Via summation. I told you earlier, your EPSPs have to summate. So there are two types of summation. First, you have spatial summation. So if I have synapse 1 here and synapse 2 here, each one fires an EPSP. That EPSP will be subthreshold, but as I described in the action potential videos, that subthreshold potential will still move. It'll decrement as it moves, but it'll still sort of propagate through this membrane, okay? And so this one propagates, and this one propagates, and if they come together, they summate, and they make one big depolarization. So this one comes together with this one spatially, and they add up. And if you get enough of these that add up, you'll get enough of a depolarization to hit threshold. So that's spatial summation. Temporal summation is when you've got two action potentials that fire rapidly in succession and the same synapse. So if we're talking about synapse 1 here, you get a subthreshold potential, a firing here, and then another one fires really quick before this returns back down to rest, and you get an addition. So this would be two APs in succession rapidly. So this is temporal summation, where they sort of add up in the same area. If you get two action potentials that arrive in rapid succession, okay. Summation is usually a combination of these two things, okay. In a CNS neuron, Usually you have both things going on, and you eventually add up the EPSPs until you hit threshold if you're going to fire an action potential. Okay. Why is the process of summation important? Why does this act differently? The way that I think about it is that if you've got a brain neuron, you don't want that brain neuron to just fire at any old whim. You have decisions that have to be made, and decisions usually require multiple inputs. There's a lot of things that go into you and I making a decision. It isn't just an on and off switch. It's like there are a whole bunch of factors involved. So the central nervous system sort of operates that way. It's a bunch of inputs that kind of tend to want to make your neuron depolarize, or maybe they tend to want to resist it. And it's the balance between the two that decides whether this is actually going to fire or not. So it's a different kind of process because it's really complicated. There are usually a lot of inputs that are needed to basically, quote, make a decision, unquote, and cause a neuron to fire. Okay, and that's happening all over your central nervous system. So this is just the way that your brain decides what to do. It takes all the inputs, it puts them together, and if they summate to threshold, you fire an action potential. And if they don't, then you don't, okay? These summate, and eventually they hit an area called the axon hillock, okay? And this is usually right at the junction between the cell body and the axon, and there's usually a high density of sodium channels there. And if the EPSPs that have now summated make it there and depolarize the membrane enough, you'll fire an action potential, okay? Because that's where the sodium channels are, that's where the action potential actually initiates. There are usually not that many in this cell body. You need to get it here before you actually propagate an action potential down this axon, okay? So that's the basics of how a CNS synapse works. Now it does get more complicated from here. We have presynaptic inhibition and facilitation. These don't directly cause a postsynaptic membrane potential. In other words, they don't directly affect the postsynaptic membrane in a synapse, but what they do is they modify the neurotransmitter release from the presynaptic membrane. And so it's an indirect effect on the transmission. So here's what I mean by that. Let's look at presynaptic inhibition. So I have two neurons, A and B. A is the presynaptic. The action potential propagates down here. It hits the nerve terminal. And neurotransmitter releases here, and that causes an action potential to fire in B. That is our postsynaptic neuron. Okay? Your C, C1 in this case, forms a presynaptic inhibitory, an inhibitory synapse on the presynaptic neuron, on the membrane of the presynaptic neuron. So neurotransmitter release from here to here does not do anything directly to this membrane, but it does affect the presynaptic membrane, okay? And it affects the presynaptic membrane in such a way that it reduces calcium influx. So you guys remember the action potential comes down, calcium channels open, the increase in calcium in this nerve terminal causes neurotransmitter vesicles to fuse with the presynaptic membrane, and you get neurotransmitter release. If you reduce the calcium influx, you make the neurotransmitter release less likely, or at least you reduce the release. So you can see that here. This is the presynaptic membrane and the action potential in that, and this is the calcium influx. Now note this is a downward deflection because it's considered to be an inward current. Calcium coming in. The calcium coming in causes neurotransmitter release, which causes a increase in the voltage in the postsynaptic membrane here. So if we have this C1 firing, we inhibit calcium influx, so it's less. And that causes less neurotransmitter release, which means that I get less of an increase in voltage in my postsynaptic membrane. So that's presynaptic inhibition. The less neurotransmitter less increase in voltage, fewer or lower EPSPs. You can think of it either way, okay? If we're talking about presynaptic facilitation, again, we have our presynaptic and postsynaptic membranes, and RC2 causes postsynaptic facilitation. Again, it synapses on the presynaptic membrane. In this case, it causes an increase in calcium influx, and that increases neurotransmitter release. So here's my calcium influx. The dashed line is the increased calcium current. The increased calcium influx causes an increase in calcium in the nerve terminus. That causes an increase in neurotransmitter release, and that causes an increase, the dashed line is facilitated, an increase, bigger than normal increase in voltage in the postsynaptic membrane, okay? All right. We haven't talked much about indirectly coupled synapses. I don't really want to focus on them, but they do have some specialized characteristics you should be aware of. They often involve second messenger systems, so you guys know that. G proteins will often cause things like increased cyclic AMP and PKA activity. So the deal with second messengers is that they diffuse out. So if you're talking about a directly coupled synapse, you're talking about a pretty local event. The neurotransmitter binds the channel's right there in the synaptic cleft, and your ion flux changes. In this case, because second messengers diffuse, you get a less localized response, okay? So indirectly coupled synapses tend to have broader, more global effects. The other thing is that they're typically long-lasting. In the case of a directly coupled synapse, if my neurotransmitter unbinds, the channel closes, poof, that's it. It's over. You know, you've terminated it. In the case when you're generating second messengers now, and they've diffused all over the place, now you've got this slow process of eliminating the second messengers and terminating that response, even when the ligand's not bound to the receptor anymore. So that tends to take a fairly long time. So these tend to last longer and they're less localized. Okay, and you should be aware of that. Because these are longer lasting effects, they tend to be associated with longer lasting responses. Responses that require increases in protein expression or something like that. You might find that things like, sometimes things like memory or something might be associated more with the indirectly coupled synapses, because you tend to want responses that last longer. Okay, so they tend to be those kinds of responses. All right, neuropeptides. I'm going to wrap up with that very briefly. These are also called neuromodulators. They are stored in vesicles, just like any neurotransmitter. They have a special name called dense core vesicles. They show up as particularly dense areas in electron micrographs. They are full of peptides. They are released in response to calcium, just like normal neurotransmitters. You open calcium channels, the calcium comes in, it causes exocytosis of the transmitter into the cleft. However, these don't fuse with just any old action potential. You tend to need a high frequency of action potentials that all arrive very quickly, one after another. And that will actually cause the release of peptide from these dense core vesicles, along with your regular neurotransmitters. So low frequency, you have regular neurotransmitter release, but the dense core vesicles don't fuse. High frequency with lots of calcium coming in, then they tend to fuse and you get release of both. These are indirectly coupled receptors, okay? They can be on the presynaptic membrane or the postsynaptic membrane, or both. And they bring about long-term changes that enhance or depress synaptic effectiveness. So, for instance, they may change neurotransmitter synthesis, or postsynaptic receptors might increase in density because of increased expression because you've released these neuropeptides. So because of that, they're called neuromodulators. They tend to alter the response in the synapse in kind of a slower, long-term sort of fashion. So again, this is just meant to introduce this. They'll go into a lot more detail in brain behavior and cognition when it comes to stuff like this. So I'm just introducing it along with the synapse. It seems like an appropriate place to do that and make you aware of it. Okay? That is all I got. Thank you for your attention, and I'll see you soon.